So then it will becomes difficult. So take one full binder, and this will be a needle which we will demonstrate during the live surgery of chloroplasty of intracorporeal suturing. So this is one of the common needle we use. And so again, as I said, again technique is same. Hold the thread approximately 3 centimeter, and so you can notice that 45 mm needle has easily possible suturing. So stay tuned. So when this needle across the skin incision, and then with the help of needle you can push, then 50% of circumference. So half the length is ahead, half the length is back side. Needle is not at a correct angle to you. Hold the swage end of the needle, that is thread end, and then again you approach the mid. So this is the way you can manipulate.